Here is going to be our agenda for today. We're going to start off by reviewing some midwifery bills and some key issues that are impacting the profession. Then we're going to go over what a testimony is. We're going to talk about the differences between written and oral testimony. And then we're going to talk through how do you draft written testimony and also how do you deliver oral testimony. We're going to go over some specific examples of oral testimonies on those three specific bills. They were also sent out to all of you in the reading materials. So hopefully you got a chance to listen to those audios of those committee hearings for those oral testimonies and also pick up on some highlights that we'll be reviewing from that. Then we're going to go over the group assignment for session 2, which is going to be drafting 1 to 2 pages of written testimony based on your assigned topic. And then we're going to wrap up by talking about some next steps for session 3, where each group is going to have the opportunity to deliver a 2-minute version of the oral testimony live in session 3. So more to come on that. So here are some midwifery bills and issues that are affecting the field. These issues that we're going to talk about really focus on the same topics that will be assigned to each group for the written testimonies. And also, as a reminder, the Quality Institute does not lobby. Our main role is really to educate and to explain what the impact of different bills and policies will have. So for our first bill, we have S3701. This is going to provide independent prescriptive authority to midwives. The primary sponsor is Senator Vitale. In terms of the impact for this bill, in New Jersey, we know that CNMs can already prescribe drugs based on the standing orders and practice protocols that is in agreement with a collaborative physician. The difference now is that this bill will now also include CMs, and it will also give them that same ability to prescribe drugs independently. So this bill was introduced in the Senate. It was referred to Senate Health, Human Services, and Senior Citizens Committee on September 30th, 2024. And that's been the latest action to date. For our next bill, we have A5527/S4487. This bill is going to create the Midwifery Licensing Act. It also modifies the regulation of midwifery by creating an independent board of midwifery. So this bill also allows CNMs and CMs to prescribe drugs independently to the extent of their training and their scope of practice. So the primary sponsor for this bill is Assemblywoman Shanique Spate. This bill has been newly introduced on April 10th, and it was referred to the Assembly Regulated Professions Committee. This bill has also had past iterations within past legislative sessions, and so you see the past bill numbers associated with this one. But the one that was introduced in April 10th has been newly introduced. This bill would create a new independent board of midwifery that would oversee midwifery practice, and it would replace the Board of Medical Examiners. And so that new board would have 11 members, and the majority of them would be midwives, being 7. And again, just in the bill text, we did not see any mention of eliminating that collaborative agreement. So important considerations for drafting the written testimony for this bill. So another important issue that is impacting midwifery is payment parity. So we know that midwives typically have lower reimbursement rates compared to physicians, even when they are providing the same services. Out of all of the payers, only Medicare provides equal reimbursement to CNMs at 100% of the rate paid to physicians, while Medicaid and other commercial insurers do not. Medicaid also does not cover home births, which we know would be attended by midwives. And so that's just more of a driving point to re-emphasize that reimbursement parity from all payers is important in order to make sure that midwives have fair compensation and in order to make sure that there's more access to midwifery care. And then we also have autonomous practice still needing to be implemented in the state of New Jersey. So New Jersey's statute tethers or ties down midwifery practice to a specific physician. Midwives are required to have written clinical guidelines with a consulting physician licensed in New Jersey in order to practice. But we know that in actuality, this requirement actually limits a midwife's autonomy, and it prevents them from practicing to the full extent of their licensure, and training. And so all of these key issues, again, will be focused on for our written testimonies. So let's move on now to talk about the purpose of providing testimony. So the purpose of testifying is to persuade legislators to either support or oppose legislation. Testifying can take many different examples. So it can be in the form of written testimony, oral testimony, or signing slips of support or opposition for a bill. Testifying also sends a strong message to legislators. It lets them know that this bill is very important. And so it sends a strong message when there are a lot of people who are testifying and signing up to do so. So providing testimony allows people to accomplish the following items. Number one, it allows you to provide your expertise and your lived experience to better guide policy decisions. It also allows you to give more education and context to policymakers, especially if they don't have expertise on the issue that that bill is addressing. It's also a way to show public support or public concern about an issue. And providing testimony is a way to, your testimony basically becomes a part of public record. So it's a way for stakeholders and people to refer back to what you said in the future. So I'll hand it over to Max, who's going to talk about the differences between written and oral testimony.
Okay, good morning, everyone. So the key differences between oral and written testimony. For written testimony, typically you would submit this prior to when you present oral testimony. Oral testimony is presented before the committee, whereas written testimony is typically sent prior, and you do risk the fact that the members may not read it beforehand due to timing or workload, potentially reviewing it for the first time on the hearing day, which isn't always the greatest. So you want to keep that in mind. And you also want to keep in mind how long your testimony is going to be for written testimony. We typically say that it should be 1 to 2 pages. Really shouldn't be exceeding that amount. They typically won't be able to read all of it. There also, for oral testimony, we often tell people that because it's delivered live, you want to possibly practice presenting your oral testimony prior. It's recorded and available for review afterwards. So you want to keep that in mind. People will have your record saved either orally or virtually through video receipts. So you want to keep that in mind. Your written testimony is also saved in a written record that goes to all members of the committee and their staff. And the committee aides keep a record of your written testimony as well. So if someone wants to go back and cite your paper, they can. And communications are often emotionally intense, passionate, or a depth of knowledge directly to the audience. We've had providers come in. We've had people that run their own experiments come in. We've had people with lived experiences come in and talk about those bills. So overall, oral testimony often has greater immediate impact for you. And the influence due to its interactive nature can make it easier for people to get questions answered. But that doesn't mean that written testimony isn't as equally powerful. Next slide, please. Okay.
Yes. Perfect. So now we're going to move on to talk about the format of written testimony. So here is just a general template that you can follow when you're structuring your writing to draft written testimony. So number one, you want to provide a title. That title can include the bill number that you're writing about. If you're writing on behalf of yourself, you can also include your name in that title, or if it's on behalf of an organization, you can include that as well. So for example, testimony of John Smith for Assembly Bill 3012. And you can also substitute that for your organization's name. You're going to move on to the opening paragraph, which will serve as your introduction. So you want to make sure that you are greeting and you are thanking the committee for the opportunity to testify. So what that may sound like, for example, thank you to the committee of XYZ, you're going to name that committee, for the opportunity to provide testimony on A5231. That's just an example of what some of that language may sound like. In your introduction, you also want to introduce yourself. So you're going to state your name, your role, your organization, and you're also going to explain your relationship to that issue, your relationship or your expertise. And then you also want to clearly state your position on the bill. You want to make that very explicit in the introduction paragraph. From there, you're going to move on to your body paragraphs. So you're going to provide about 3 to 4 paragraphs that really talk about your key points regarding the bill. And you also want to use research, data, and your expertise to support your points. And you can include any external sources in the footnotes and annotate that. And then you finally want to wrap up with your closing paragraph. You basically just want to thank the committee for having the opportunity to provide testimony. And then you want to provide a call to action that summarizes why this issue is important relating to the bill. So here are just additional tips to keep in mind while you're drafting your written testimony. So number 1 is the length. You want to keep your written testimony 1 to 2 pages. The shorter, the better. And this is because you do not want to overwhelm the reader with too many details. Your goal is to provide education about that bill, the topic about that bill. You do not want to assume that the lawmaker has the same amount of information or the same expertise as you. So use that as an opportunity to educate. You also want to describe the problem, explain the consequences, and then offer solutions within your written testimony. Make sure that you avoid, heavy jargon or just overly complicated terminology because that may cause confusion. And you also want to make sure that you are using action-oriented language. So for example, I urge you to support XYZ. Passing this bill will protect and improve XYZ. The language is very action-oriented and it's not passive. So you want to make sure that you're doing the same as well. You can also support your points with data when it's appropriate. Again, provide a clear call to action that you would like the committee to take with the bill. And then also make sure that you are organizing your written testimony with headings and bullet points to structure your writing. And then again, you want to make sure that you are proofreading for any grammar. So I'll hand it over to Max, who's going to cover oral testimony.
Thank you.
Can I jump in real quick with a question that came up in the chat just before we lose the thread, Harmony?
Yes.
Kel asked if someone could provide an example of how you would explain to a lawmaker, like in written testimony, why reimbursement parity would increase access to midwifery care. That we can certainly address that, but I'd love to throw that question back out to the full group if anyone has ideas or thoughts.
I can talk to it.
Okay, great. Thanks, Julie.
So one, I think money matters, and money, so increasing access to care, I feel like there's sort of many ways to think about this, but I think that when providers are reimbursed at a higher rate in any given insurance, they're attracted to enrolling in that insurance as a provider. And then the people who necessarily have that insurance have greater access to a wide variety of providers. So for example, if Medicaid increases their reimbursement rate, potentially more midwives will enroll to Medicaid providers, and then more Medicaid recipients will have access to more midwifery care in a very straightforward way. I also think there's this optic about money and reimbursement and value. And on a very personal level, I've had hospital administrators in New Jersey, when I talk about, for example, increasing salaries for midwives or hiring more midwives or having student midwives or advocating for independent practice. And on more than one occasion, I've been told that, if midwives have pay parity, if midwives don't have pay parity, then there's an optic that they're a less valuable provider, which we know is preposterous, but it is an optic, and to circle back to them when we have pay parity, and that then they will advocate. And so there's this other piece about sort of the optic of value and how much providers are reimbursed.
That was excellent, Julie. Thank you so much. I don't know if anyone else wanted to answer, but if not, we can just hop right into the next slide. Well, all right, seeing none. Okay, so how to develop oral testimony. So the considerations to think about when preparing for oral testimony is one, you want to really know what your core message is. What do you want the legislator to take away? You want to clearly articulate the main point or your goal of the testimony. Why is this bill important? How does it affect New Jerseyans, either positively or negatively? Who does this bill impact the most? Why does it impact them? A lot of times legislators are trying to do good, but they're not experts in certain fields. And so even if they have the greatest of intentions, they may leave some key information out. They may be missing something. They may need an additional lens to look at the bill. Maybe it sounds like a great bill, but in actuality, when you look at the underlying meaning or who it would negatively impact, it's no longer a great bill and they need to clean the bill up. So you want to incorporate personal stories as well. Many of you guys have lived experiences being midwives or studying as midwifery students, and you can have and pull testimony from your own lived experiences out in the field, or maybe even personal stories as to why you chose this field, what you have experienced. You can use specific examples or personal anecdotes to illustrate any points that you may have. This makes your testimony more relatable and impactful. While you're doing this, you want to maintain eye contact. So engaging with the committee members by making eye contact, this conveys confidence and sincerity. You want to also take this time to use your notes wisely. So while it's acceptable to refer to notes, avoid reading your testimony verbatim. If this method works for you, speaking as naturally can be more engaging. Obviously, that's if this is something that works for you. I know some people are not as able to think quickly on their feet. So if that's not a system for you, then you don't need to use that. But something else that you really should pay attention to is anticipating opposing viewpoints. Not everyone on the committee is going to have the same opinion as you. Not even if you take the time to beautifully explain in detail, why does this matter? Why does this impact marginalized populations? Why does this make birthing experience in New Jersey ultimately better? You may still be challenged by someone on the committee that says, well, why should we spend money for this in this manner? Why should we do X, Y, and Z? And rather than be upset or surprised, you should anticipate that and come up with some answers that you might get, that opposing viewpoints might come up, so that you are more prepared. You want to use clear and concise language. Army discussed this as well. You don't want to be using really complex jargon or long abbreviations that only you guys would know the answer to. For example, the previous chair of health used to be a doctor. So I think for years, people were able to really get into the weeds with him. The chair right now is Assemblywoman Carol Murphy. She is not a healthcare professional. She may not be as well versed as Assemblyman Conaway in taking in some of those terminologies and terms. You want to also utilize rhetorical strategies such as ethos, which is credibility, pathos, emotional appeal, and logos, logical reasoning, to strengthen your argument. You want to dress appropriately, wear professional attire to convey respect. And then I always say that this is very, very important. Practice your delivery, rehearse your testimony multiple times, get used to people asking you questions following your testimony, maybe come up with some mock questions that you might get asked. And then you want to practice your delivery. You want to rehearse, make sure that you sound, you know, concise and clear. And then you want to be prepared because you just never know what you might be asked. Next slide, please. Okay. So how do you sign up to even provide testimony? For written testimony, this is where last session's training comes in, where we talked about knowing who to email and what their email addresses is. You're going to check the committee schedule regularly on the New Jersey Legislative website. You're going to email a committee aide. You're going to find their name on the NJ Leg website under the legislative tab. Your testimony will then be distributed to all committee members and the chair. You want to keep this under 2 pages. For oral testimony, it's essentially the same thing, except you're doing this in person. So you want to arrive on time for room confirmation. The reason you want to arrive on time is because sometimes they will last minute change the committee rooms, and you want to make sure that you're aware of that. You don't want to end up in the wrong committee room. So you want to check that in advance. There will be designated slips in the designated room. So you're going to locate the table with the testimony slips. Fill out the slip indicating your name, your organization, if you're representing any, the bill number, your position, whether or not you support or oppose the bill, and whether you wish to testify. You are able to put in a slip of support or opposition without giving actual testimony. But that's up to you if you choose to provide testimony. Once you submit the slip, the way that you even submit the slip is that you must either find an OLS staffer or a Democratic aide in the room. They'll likely be standing behind the chair of the committee. They'll be the people walking around with the important papers. You'll reach out to them and let them know that you signed the slip and you want it read into the record, and you will be called upon when it's your turn to testify. It's really important to be mindful of the time spent on each bill, especially if a bill is really popular. You'll find that the chair might even limit you for, instead of just limiting you under 3 minutes, you might be limited to just 1 minute. So that's something you want to keep in mind. Next slide, please. Okay, so we took the initiative to comb through some key oral testimony that we found to be quite impactful. So for Bill A3505, it establishes protected leave under Family Leave Act and family temporary disability leave benefits for bereavement for death of a child, miscarriage, stillborn, and other circumstances. Those other circumstances include a child dying during adoption, and so the parent was not able to go through that process, or a failed surrogacy, whether that's because the person that was trying to go through with the child had issues or there was issues with contracts. So what made the testimony so impactful for this bill, and I implore you to all go back and try to listen to it, is that there were powerful and emotional accounts detailing the experiences of miscarriage and stillborns. People provided a recap of both bills and what stood out to them. And what stood out to a lot of people were their own lived experiences with miscarriages, with stillborns. It also was testimony that included teachers forced to return to work without adequate bereavement leave following personal loss. How does this impact you currently? Who does this law currently negatively impact? Those very teachers that we say that we support and that we care about. Potential impacts further. Advocates expressed strong hope that the bill would eventually provide positive change in the lives of individuals and provide critical periods for people to be able to grieve appropriately. So that's how Bill 305, A3505 had strong, powerful testimonial. For A3366, it establishes women's menstrual health program to identify and assist patients with symptoms related to endometriosis and polycystic ovary syndrome. We actually had someone from Planned Parenthood come out and provide testimony as an advocate to share impactful stories of other people's lived experiences with endometriosis and how it impacted their daily lives. We talked about students not being able to go to school, women not being able to go to work. We talked about absenteeism and how sometimes you having a menstrual disorder can impact that. We also had in the past doctors from the Endometriosis Foundation of America who are reproductive endocrinologists. I think that was really impactful. And so people really got to see like what it meant for a real provider, to what their opinion was on that bill. And then for A3852, it's a psilocybin behavioral health access bill. Basically, it helps people administer the production and use of psilocybin and promotes therapy and wellness. What was really cool about this testimony is we had a doctor who was very well accomplished, went to various institutions for her medical degree, and she actually conducted the experiments that people did for the psilocybin, and she was able to speak from just from her own lived experience and as an expert why that was important, why psilocybin treatment was needed, how it was revolutionary, why it was on the cusp of something new. And then there was interactive dialogue because, like I said, at the time, the chair was a doctor. And so he was able to ask really key questions about how this worked, what the side effects might be, and things of that nature. And right now, Assemblyman Azaridi is a doctor. He's an anesthesiologist. He sits on the Assembly Health Committee. And so he may have some questions for you guys when you guys are asking or talking about midwifery. Um, Next slide, please. And I think I saw a comment. Could
Yeah, Max,
Yeah.
the question is whether you could share the outcome of these bills. Did they move on? Did they pass? Or
Oh,
are they sort of
yes.
lingering?
That is a great question. Okay, so for A3505, it has passed the assembly, is now being weighed. It's now waiting to be heard in the Senate. I think it just needs to be heard in Senate budget right now. So it's pretty much almost done. This bill moves very quickly each session because of how impactful the testimony around this legislation is. Every time I see testimony for this bill, people don't have additional questions, people don't have pushback. They just want to move that bill forward. And this is the furthest the bill has gotten. It now just needs to be heard at the final end in the Senate. For A3366, it has also passed in the Assembly, needs to be heard in the Senate, needs to finish up in the Senate. So it's moved rather quickly as well. For A3852, we were told for years that we would never hear this bill heard in a committee, that no one would ever hear about psilocybin in a committee before. But so many advocates kept reaching out to legislators about this bill. Finally, the speaker was persuaded and the chair of health was persuaded, and we ultimately did finally hear the bill for the first time in quite some years in the health committee. Now the bill has been referred to another committee. It has not moved since then, but the fact that it was heard in the first place was really impactful because people did not expect that bill to ever be heard. And that's how advocates can help push legislation forward, and how moving impactful testimony can ensure that that it can move even further. And I'm seeing someone said that they actually saw the testimonial for A3852, and if you were there, you would have seen like genuinely utterly fascinating. This doctor really knew what she was talking about.